Hip impingement can cause pain, inflammation, and mobility problems, and if it's left untreated, can even lead to bigger problems like osteoarthritis or labral tears. If you think you have hip impingement, or you already know that you do, this video is here to educate you on what hip impingement is and what you can do to ease your worries and pain associated with it. Hey, I'm Alex Dreisword. I'm a licensed physical therapist here at EW Motion Therapy in Birmingham, Alabama. I understand how painful hip impingement can be and how much it can impact your daily life. In this video, I'm going to explain some of the common causes and symptoms of hip impingement, different treatment and relief options, and a number of different exercises that you can do at home to improve your strength and reduce pain in your hip. So let's start with what causes hip impingement. It's not always just one thing. Most of the time, it's a mix of different factors that come together to create this perfect storm of pain and stiffness. Sometimes the ball and socket of your hip just doesn't quite fit together. The head of your femur may be slightly misshapen, or the hip socket could be a bit too deep or too shallow. Either way, this mismatch in size can cause friction in the joint. Cartilage or other soft tissue in your hip may get caught between the bones. That pinching can oftentimes lead to inflammation and pain. Developmental factors can also play a role. As your body grows during your teenage years, playing intense sports that involve a lot of hip movement, such as soccer, gymnastics, or even hockey, can actually increase the chance of developing a hip impingement. So how do you know if you actually have hip impingement? Imaging like X-rays or MRIs might show differences in the shape of your hip joint, but that doesn't automatically mean you've got a problem. You only really have a hip impingement if you're feeling pain or losing mobility. Really about the symptoms, not just the structure or what shows up on the image. The biggest red flag is pain in the groin area. And this isn't like soreness from a tough workout. This pain tends to stick around and might even radiate down into your outer thigh. You'll probably notice it more when you're doing things that put a lot of additional stress on your hip. But it can also occur after long periods of sitting. Another common complaint is stiffness. Your hip may feel just really tight, like it won't move the way it used to. You might feel a lot of clicking or locking sensation deep down in the joint. That's usually a sign that the bones or the cartilage aren't gliding smoothly across each other, and it might be time to see a doctor. So what happens if you think you've got a hip impingement or you've already been diagnosed with it? The key thing to remember is that treatment should always be tailored to you. Let's start with physical therapy, which is often the foundation of managing a hip impingement. A big focus in physical therapy is getting joint stability. Basically, the stronger the muscles around your hip, the better support your joint has. When your hip flexors, your glutes, hip adductors are weak, the hip joint can take too much stress. Also important are your core muscles like your abs, lower back, obliques. They help control your pelvis and posture. With targeted exercises, a physical therapist can help strengthen those areas and stabilize the joint. Now let's talk about mobility. If your hip doesn't move well, everything around it has to work so much harder. Physical therapists use stretching, exercises, hands-on techniques to help loosen up the joint and the tight muscles and improve circulation to the area. This can reduce stiffness, ease pain, and support the healing process. Moving on past physical therapy, another huge part of the treatment is education and activity modification. Your care team can help you figure out which movements to avoid and how to adjust your posture or habits during your daily activities. It's not just about what you do during a workout. It matters how you sit at your desk, how you move throughout your day, how you recover from physical activity. But if things aren't still improving, your doctor might recommend injections. These usually include a corticosteroid, which helps bring down the inflammation, or a local anesthetic for pain relief. It's not a cure, but it can provide some breathing room, allowing you to move more freely and get back into your physical therapy or exercise program with much less discomfort. But what if none of that works? That's when surgery might come into the conversation. Now, surgery for hip impingement isn't taken lightly. It usually comes after you've tried all your other options without much relief. If the pain is really interfering with your life and keeping you from performing basic actions, then it might be time to consider your surgical options. Everyone's body is different, and the plan that works for one person might not be the right fit for someone else. That's why working with your doctor and a solid healthcare team is so important. Now, what are some things that you can do at home right now to start improving your symptoms. Physical therapy is helpful in the clinic, but most physical therapists will also provide an at-home program for you to follow during the time between your appointments. Here are some examples of exercise that I would send home with my clients if they came to me for a hip impingement. Remember though, not every person is the same, so if you have any concerns about doing these movements, consult with your doctor or physical therapist to ensure it is safe for you to do. So the first stretch that we're going to do is called a half kneeling hip flexor stretch. What you're going to start with is I want you to get something soft like a pillow to go under your affected knee. So the hip that you're dealing with is going to be the one kneeling down on that pillow, and you're going to get in the position like this. The first thing I want you to think of is to really squeeze the back side. So in this exercise, I'm going to be working on stretching out my left hip. I'm going to squeeze my left glute, engage my core, and you should feel a good stretch down the front of that left thigh. You can even lean in just a little bit to get a little bit more stretch. You're going to do that one 2 to 3 times a day, holding for 30 seconds. So our second exercise, we're going to work on engaging some of our outer hip stabilizers. What you're going to do is get a mini little loop resistance band and put that around your knees, right above the knees, and then lay back on the floor like this. You want your feet about hip width apart, and then what you're going to do is just take your knees, slightly press out into those bands just to get the outside of the hips engaged. And then I really want you to focus on pushing your pressure through the heels of your feet, through the floor, and pick the hips up, holding the tension in that band, and then coming back down. We're going to repeat that for 3 sets of 10 reps. So for our third exercise, we're going to keep that same band around our knees, and we're going to get in an all fours position like this here. Sometimes it helps to have something soft on your knees like a pillow. First thing I want you to think is get your back in a neutral alignment, trying to keep your back flat by engaging and contracting your core here. And then what we're going to do is just take one hip, press it out into that band as far as you can up, and then back in. And we're going to repeat, hold at the top, 3 sets of 10 on each leg. So for our fourth exercise that I'll have you do at home, we call it a hip controlled articular rotation, or for short, you can call it a hip car. You're going to stay in that all fours position. Same thing, keeping a good alignment in your spine, trying to keep it flat with your core engaged. You're going to take your affected hip. In this video, I'm going to use my left. We're going to bring it up as far as you can tolerate. Try to bring your knee towards your chest, nice and slow. And then you're going to bring that knee out as far as you can without losing the alignment in your spine. Bring it around all the way to the back and then back in. So I'll repeat again. So we're going to bring that knee up towards the chest as far as you can without moving your spine. Bring it out without rotating your spine. Then turn that foot out all the way around and back down. And we're going to repeat that for the same rep scheme, 3 sets of 10. Thanks for watching. I hope this video has provided some clarity about hip impingement and that these exercises will be helpful for you. If you have a severe hip impingement and are worried about the risk of developing a labral tear, check out our video below. This video explains the causes, risk factors, and how physical therapy can help with a hip labrum tear.